going to talk about shaping fistula in future. Assalamu alaikum. I welcome you all on this fistula day. I'm Dr. Shumaila Naeem, Associate Professor in charge Unit 2 and Clinical Coordinator Fistula Project. Fistula is not only treatable but preventable. So, what are the features or what are the things which we should do to prevent fistula? We should provide universal access to quality care to the patients. Skilled birth attendance and emergency obstetric care will be provided, then the fistula will be preventable. Women empowerment and education is important. Training of the midwives is important, and strengthening the BHQs and THQs so that that system will be strengthened, the referrals will be less, most of the patients will be managed over there without complications. Essential immediate catheter treatment, which is a Dr. Key's protocol that we should, if we suspect some sort of bladder injury, we should prolong catheterization so that the healing process occurs and fistula can be prevented with this. Training of young gynecologists regarding the safe pelvic surgeries and avoid the unnecessary C-sections. So what is the prevention roadmap? The prevention roadmap is that early detection of the obstetric labor, universal access for the safe cesarean section, delay early marriages and pregnancy via the education of the community, and timely emergency referral of the high-risk cases. So our goal is to near zero incidence of new fistula cases globally by 2030. So what is the holistic future? Holistic future is reintegration. Treating the whole person via integration. Surgical closure is just the first step. Holistic integration includes the psychological support of the patient and the family, counseling to overcome years of the social stigma which the patient has faced, economic empowerment, vocational training and microloans for the sustainable livelihood because they are economically deprived as well, and the survivor advocacy, empowering former patients as educators in their own villages so that they treat their so that they educate their community regarding this problem, and if anyone is suffering from that, they should seek immediate health care. So the paradigm shift is consolidation of the care. Center of excellence should be made, like Pims is a center of excellence for fistula care, and shifting from many small units to consolidated high volume centers. And second is integrated training, incorporating the fistula repair into standard OBGYN residency rather than an isolated charity skill. This is the future because the more doctors will be trained, the more it can be treated. Digital health is the global hub. Open data should be available, that is to identify the hot zones of the fistula by tracking its prevalence, the areas where it is common. Then mentoring, like senior surgeons guiding their local residents through complex repairs via high-speed digital links. It is our moral and social responsibility that we should train our juniors, our residents regarding the fistula repair so that in remote areas they can treat this themselves. And then follow up mobile health apps for long term monitoring of the continence and mental health of the patients in their post discharge period. So, the theme of this year is health is a right. Invest to end fistula and childbirth injuries. Thank you so much.